Okay, I'm going to start the press conference. Good afternoon. I'm Mike Butler. I'm the Public Safety Chief for the City of Longmont. With me here today in the press conference, joining me are City Manager Harold Dominguez, Community Services Director Karen Roney, and members of our City Council, Sarah Levison, Bonnie Finley, Gabe Santos, and Brian Bagley. I want to thank all of you for being here today on such short notice. I think we have important issues we have to discuss. As a community, I think we have important issues we have to discuss as a society. As you all know, in the last couple of days, our community experienced a couple of tragedies. Those tragedies were clearly unimaginable, unforgettable, similar but singular. 3 families were devastated, and the issues themselves continue. I want to talk a little bit about the families. I just want them to know that on behalf of the city, on behalf of public safety, that our community really will support you. You are part of us. You belong to us. You're part of our community. There will be many people who want to reach out to you. I know that will be the case. And we would ask that if you have any kinds of needs, that you feel free to speak up. This is something that's very, very important for you to think about. I also want to talk about our community. I've heard over and over again, and I've heard from many other people, that our community was quite traumatized. This is something that's quite unusual. These events unfolded within a matter of hours, and because of these kinds of events, our community is now in a significant amount of pain. And I want to let our community know that there's going to be a lot of follow-up in terms of trying to determine what we can help in terms of the helping you all to work through these issues. There will be a gathering in the not too distant future, perhaps some kind of candlelight vigil, and we want everybody to attend as much as possible. I also want to say that I've lived in this community for many years, and I know of the abundance that this community has. I know the gifts that many people have in this community. I know of the spirit of kindness and care that this community has and has for a long time. I know of the amount of humanity that exists between people and amongst people in this community. It's in abundance. And those are the things I think we need to focus on. I know you from the media. I understand that these emotional, dramatic moments can kind of carry the day, but I also think that the dignity and the wholeness of people in the community carry a much bigger part, and it's something we need to focus on from this point forward. And so again, I thank you all for being here today. One of the underlying concerns, as we're seeing them in both of these cases, I'm just going to say, is mental illness. We're concerned about the issue of mental illness in our community. In fact, I think our entire country should be concerned, and probably is, around the issue of mental illness. I think I can speak for every police chief and sheriff in this country who says that they devote a tremendous amount of resources to responding to calls for service that involve mental illness. And it's something that we don't know why, but seems to be becoming more frequent. And it's something that, you know, how we've been trying to address it, I think, is something we need to look at differently. I think the conversations need to change dramatically. I think we need to shift our thinking in terms of how we address mental illness in our communities. I can assure you in Longmont, that's where we're headed. Mental illness is something that probably strikes everybody. I doubt if there's a person here who doesn't know somebody, a family member, a relative, a neighbor, or a friend who's not suffering from mental illness. It's prevalent. It's something that we can no longer hide. The stigma of mental illness is something that we need to eliminate. Many people who have mental illness hide in the shadows of our communities. They feel like they don't belong. And you know, and the fact is, when we look at folks who have mental illness, we actually call them a problem. We say that person is mentally ill. We don't acknowledge the gifts or the strengths or the assets of people who have mental illness, but yet they do. And because we have marginalized them at some level, the gifts they have never make it to the center. And so I know the issue of mental illness is pervasive in our community, but our community is not unique. And the message I want to send is that we do need to change the conversation. We do need to shift how we're approaching mental illness in our community. Now, I will say that there is a certain amount of public funding that goes to service providers that deal with mental illness in every community. But I will also say, let me back up and say that I know many service providers, and I know that they do the best job they can with the resources they have. But in the final analysis, the amount of public funding we have for mental illness is about this big. The problem is this big. And so how do we address that? How do we begin to either lessen the problem or enlarge the resources? That's the only two ways I can see. And the fact of the matter is we're probably not going to enlarge public funding resources too much. All of you know about the incidents in Newtown and the Aurora Theater. The issue of mental illness became big after both of those events. Many people talked about it. News stations kept it up for the broadcast media, the print media talked about it for about a month. And then it seemed to kind of go away. And so what we can't have anymore is a temporary, kind of momentary response and focus with mental illness. It's something we need to deal with on a more consistent, sustainable basis. Or else we're going to continue to confront issues like we're confronting every day in this community and every other community is confronting every day as well. And so my thoughts on this, and I've shared these with my colleagues, is that we need to figure out how to get our community much more engaged. And we do have resources in our community that can come to the surface and would be willing to work at a much different level. We in government and our service providers in mental illness, in the mental health field, have to acknowledge that we cannot do this by ourselves anymore. And so that's something, that's part of the conversation that's going to have to shift. Another part of the conversation that's going to have to shift is that we can no longer allow these folks who are struggling with mental illness to exist in the shadows and the margins. We have to invite them in to our community. We have to embrace them. They have to know that they belong to our community. They have to know that their gifts, their assets, and their strengths are important for our community. We have to quit labeling people as mentally ill. We have to identify them by who they are as people. And so we have to develop a comfort zone for all of us. The other part that needs to shift is that we need to stop being afraid. We need to stop being afraid of people who do suffer from mental illness. I understand that we just don't know a lot about it. I understand the stigma. I understand that there's something there that perhaps is unknown. And with all those factors, sometimes we can become fearful. Well, we need to figure out how not to be fearful and afraid anymore. And on top of all that, we need to figure out how to galvanize, convene, and bring together all the community resources we have, way beyond public funding. We have to figure out how to change the perception that we have around mental illness, and we have to figure out how to become one community, including those people who struggle with mental illness. Now, I can sit here and use the phrase, it takes a community to raise a child, to deal with other issues like homelessness, like addiction, like poverty, but it's going to take a community to deal with mental illness. And that's just the bottom line. And so part of my frustration or part of my passion or part of something that I want to be able to do in the future in my role here as the Public Safety Chief is to be able to invite and challenge our community to come forward in a way that we can begin to have community-wide conversations. And that those conversations can lead to a more broad, comprehensive awareness, consciousness, and solution around how we're dealing with the issue of mental illness. I'm pretty convinced that if we could do something like that, and we could begin to change the perception that we have of mental illness, and we could begin to look at people who struggle with mental illness as people who do have gifts, that we could begin to address this issue at a significantly greater level. And that's something that I think we all need to be thinking about. And so I'm going to end my comments there, and I appreciate you all being here. I am willing to take questions, but the other part of this is I'm not here to answer questions about either of the cases. I believe you probably have gotten a significant amount of information from our public information officer or other sources, and I'm just going to rely on that in terms of your capacity to gain that kind of information. So I'm not here to talk about the cases. I'm here to talk about what I think is a deeper, wider, more comprehensive, community-wide issue that we need to address. And with that, I am open for questions, and I know I have a couple of other people here with me who would also be able to answer questions if I can't.
Sir, I understand that you can't talk about the investigation, but since you're here talking after the two incidents and you're talking about mental illness, are you suggesting that both instances or one of them have something to do with mental illness?
I am. Let me just say, I don't know if everyone heard the question, but the question was asked, am I suggesting that one or both of these cases had a base or perhaps a cause of someone who was struggling with mental illness? And the answer is yes.
And a follow-up, are you suggesting that the last case where a woman is accused of taking an unborn baby from a woman, is she mentally ill?
I am not going to sit here and diagnose that person specifically. All I can say is that in my mind of what is considered reasonable, rational, and how appropriate normal behavior occurs, this seemed to go way outside the bounds of that. So I'm not going to diagnose somebody as much as say that there seemed to be something amiss and out of sorts, that perhaps if we would have addressed the issue of mental illness or emotional instability differently in our community, that perhaps something else could have happened.
Do you have any specific plans for including this community within the Longmont community at large?
Yes, the question is, do I have any specific plans to include the Longmont community? Yes, we do. We probably will be orchestrating and putting together symposiums. We're going to be inviting through our local media people from our community to gather in meetings to have conversations. We're going to invite a very important group that I think has been left out of the community-wide conversation, and those are our private sector therapists from all categories, our MSWs, our psychologists, our psychiatrists. Over the last couple of years, I've had the opportunity to talk to a number of them, and I've asked them the specific question, would you be willing to participate in a larger community-wide service beyond your profit motives for the good of the whole? And every one of them has said yes. And so bringing those kinds of resources, neighborhoods, faith community, community members at large is where we're headed with this.
Follow-up question, since you have City Council with you today, is the City Council prepared to allocate new funds to mental illness facilities within Longmont?
That's a question I'm probably not going to ask. I think what we get into at that point is, let me say, the question was, since City Council's here, am I going to go back to our City Council and ask for additional funding for more resources, generally was the question. The answer to that, in my mind, should be no. I think we have the community, the social, and the human capital in this community through those sources that I mentioned, that if we can bring to the surface in our community, I don't think we're going to need more public funding. That's my way of seeing it.
Can you talk a little bit about how Michelle Wilkins is doing? Their heart goes out to her. Can you share anything about just her?
All I will say at this point, the question is how is Michelle Wilkes doing? I will say that she's in the hospital and she seems to be recovering. Thank you.
Can you talk at all about, these two cases and mental health cases in general, the impact they have on first responders?
That's a great question. The impact that these cases or other cases involving mental illness have on first responders, these are incredibly difficult, complex cases. I know that in our business, in the police world, that there's a large percentage of police officer involved shootings that involve people who are struggling with mental illness. We know that. And so we've had to get a lot better at terms of diagnosing and understanding and calming circumstances as we approach those. In Longmont, we received a grant several months ago in which we have mental health service providers working out of our department who respond to calls for service involving mental health. That really is of a great assistance. But I will also say, and I don't think we're unique, in fact I know we're not unique, as I mentioned before in terms of police departments everywhere, that our resources are really taxed in that arena. And we go on multiple calls a day involving people who want to commit suicide. Sometimes suicide by cop. Now you never hear about those because 99.9% of those because nothing ever happens. And so our officers here and elsewhere have to be quite skilled in order to be able to resolve those situations where no one's hurt. And I'm very happy to say that that doesn't happen a lot in any community, certainly Longmont.
I'm just hoping you can elaborate a little bit. I know you can't be terribly specific, but are you suggesting that if something had happened differently in terms of the mental health services that this female suspect was provided or not provided, that the outcome of this situation yesterday, Wednesday, would have been different?
So the question is, am I suggesting that if there would have been a new model of how we address mental health in the community, could the outcomes have been different? I can't sit here and say for sure. And what I can't sit here and say for sure is that no matter what model we put in place, no matter how engaged our community becomes, or no matter how much we're addressing this issue in our community, that it's going to be foolproof for everyone in every set of circumstances. The answer to that is obviously I don't know or no. But I think we increase our probability. I think we enhance our chances of being able to be more proactive and preventative if we can have a lot larger community engagement.
But are you referring to something specifically that went wrong, or are you just generally?
I'm generally saying that's the case.
What are the next steps from here? You say that you don't have enough resources, you don't need to.
I'm sorry, I can't hear you, please.
What are the next steps from here as far as where you go from here to make sure to try to combat these mental illness issues in the community?
The question is, what are the next steps from here in terms of how we're going to combat mental illness in our community? I will tell you that there's already a small task force of people meeting within the city government to begin to have those conversations about how we can expand those conversations to include all the mental health service providers in our community, plus a large portion of who our community itself. And so we're just beginning the process. And I will say that these two events are certainly somewhat of an accelerating catalyst.
Do you have any advice for members of the public who may be suspecting that they know somebody that's suffering from mental health issues, how they can get involved, or first steps that they can take to maybe prevent something like this from happening?
The question is, do I have any advice for the public if they know somebody who has mental health issues and what they can do to get involved or how they can prevent? You know, I think that's a human question. I don't know if I have a professional question or a professional answer for that. I would say that, you know, engaging people, becoming friendly, developing connections and relationships, letting people know that you care and that they're valued and appreciated is a huge first step for anybody. Okay, I'm just going to leave. Okay, I'm sorry, I have one more local reporter who wants to ask a question.
Chief Butler, will mental health partners, which already exist here in Boulder, with it's been around for 50 years, will they be included in this?
Absolutely. We want every single one of our publicly funded mental health service providers to be included. I want to make it very clear that I know many of these people. I know the organizations they work for. They are doing tremendous work in our communities, and their professionalism, their commitment, their dedication is unsurpassed. But I also say that they're absolutely overwhelmed. And as I said before, I think the problem is significantly greater than the publicly funded resources that we have.
Are the officers and paramedics who responded to this call and taken off their
Yes, the question, thank you for that. The question is, are the public safety staff that were involved in the response to these two tragedies, are they receiving services to help them emotionally and psychologically? The answer is yes. As we speak, that's happening.
And I understand this is sort of a personal question, but you've been a police officer and you've been in the city for a very long time.
The question is, given the nature of these last two tragedies that we've had, especially the last case involving the baby, what's my take on that in terms of my own experience, I believe. I've already used the terms unimaginable and unforgettable, and I don't use those phrases often when it comes to the things we see.
You're reacting with compassion where lots of communities might react with blame. Why is Longmont different in that way?
The question is, we're reacting with compassion where a lot of communities can react with blame. We'll react with blame. You know, I've been around the criminal justice system for over 3 decades. And I understand that the goal of the criminal justice system is somewhat punitive, an eye for an eye, pound of flesh. I don't think that's worked all that well. I understand that there are people in our community who can't help themselves. They hurt people, they steal from people, and perhaps they've done enough to compromise their freedom. But I think there's other forces at play that if we can harness and build mechanisms and structures around those forces can be a lot more effective and a lot more sustainable. And I could speak to a few of those forces right now, but I will say that I just think that that's a larger part of the sustainable answer, and that is to bring those forces into play. And we've seen that in some of the things that we're doing already. Okay, I'm going to end the news conference. Thank you all very much for being here. Appreciate it. Okay. Okay.